I'm Amsley Sulit reporting live about one of the trending topics during this month of September, known as tularemia. To help us better understand, we will have some medical specialists explain what tularemia is.
Tularemia, also known as rabbit fever, is caused by the bacterium Francisella tularensis. Tularemia is typically found in animals, especially rodents like hamsters, rabbits, and hares. Do you know the difference between a rabbit and a hare? Not the hair on your head, but the difference is the rabbit is smaller than the hare, like the Roadrunner and Bugs Bunny. I don't think I'm making sense, but I will right now. Anyways, tularemia has been reported in all the states except for Hawaii, where you do the hula. Tularemia is more common in the months of May through September. Bites from infected ticks or deer flies usually occur in the summer months. But illness due to animal handling and hunting can occur at any time of the year. Worldwide incidence of naturally occurring tularemia is unknown. It is likely that the disease is greatly underreported, underrated, and underrecognized. In the US, reported cases have dropped sharply from several thousand a year prior to 1950 to fewer than 200 a year in the 1990s. Between 1985 and 1992, 1,490 cases and 20 fatalities were reported in the US, and a case fatality rate of 1.4%. Stay classy, San Diego.
Tularemia is caused by Francisella tularensis, one of the most infectious pathogenic bacteria known to man. It requires inoculation or inhalation of as few as 10 organisms to cause disease. Human can be infected through several routes, including a bite from an infected tick, horsefly, or mosquito, a direct contact through a skin break with an infected animal or its dead body, eating infected meat, and inhalation of contaminated dust or aerosols. This is the most common method used when Francisella tularensis is used as a biological weapon. Aerosol release would likely have the greatest adverse medical and public health consequences.
A 19-year-old female was reported to have tularemia in AUP. The teenager was brought to the hospital after experiencing an abrupt onset of fever and chills with generalized body weakness.
Incubation period for tularemia is typically 3 to 5 days, but can range from 1 to 14 days. Several types of tularemia exist, and which type you get depends on how and where the bacteria enter the body. Each type of tularemia has its own sets of symptoms. There are 6 types of tularemia. First, ulceroglandular tularemia. This is the most common form of disease. Second, glandular tularemia. It has the same signs and symptoms of ulceroglandular tularemia except no skin ulcers. Third, oculoglandular tularemia. This form affects the eyes. Next is oropharyngeal tularemia. It is usually caused by eating poorly cooked wild animal meat or drinking contaminated water. This form affects the digestive tract. Next is pneumonic tularemia. This type of tularemia is more common in elderly and in people with typhoidal tularemia. This causes signs and symptoms typically of pneumonia. Then the sixth is typhoidal tularemia. This is a rare and serious form of disease.
Francisella tularensis is highly infectious. A small number of bacteria, about 10 to 50 organisms, can cause disease. If Francisella tularensis were used as a bioweapon, the bacteria would likely be made airborne so they could be inhaled. People who inhale the bacteria can experience severe respiratory illness, including the life-threatening pneumonia and systemic infection if they are not treated. Tularemia was first described as plague-like disease of rodents in 1911. Tularemia has since been weaponized. Prior to signing the Biological Convention, the U.S. military did stockpile it for as a biological weapon. According to a former Soviet Union biological weapon scientist, the Soviet Union continued to develop stocks of the organism that causes tularemia in the 1990s, including developing strains of the organism engineered to be resistant to antibiotics and vaccines. The World Health Organization has estimated that an aerosol dispersal of 50 kilograms of Francisella tularensis, the organism that causes tularemia, over an urban area of 5 million people, could cause 250,000 casualties and approximately 19,000 deaths. Illness would persist for several weeks, and disease relapses would occur for weeks to months. The CDC estimates the economic impact of F. tularensis attack would be $5.4 billion for every 100,000 persons exposed. Although F. tularensis could be used as a weapon in a number of ways, it is believed that an aerosol release would have the greatest adverse medical and public health consequences. A weapon using airborne tularemia would likely result 3 to 5 days later in an outbreak of acute undifferentiated febrile illness with developing symptoms of pneumonia. Without treatment, the clinical course could lead to respiratory failure, shock, and death. Tularemia in humans occurs infrequently, resulting in a low index of diagnostic suspicion among clinicians and laboratories. Since rapid diagnostic testing for tularemia is not widely available, the first indication of intentional tularemia might follow recognition by public health authorities of a clustering of acute severe respiratory illness with unusual epidemiological features. Public health authorities would most likely become aware of an outbreak of unusual respiratory disease in its early stages, but this could be difficult to distinguish from a natural outbreak of community-acquired infection, especially influenza or various atypical pneumonias. The abrupt onset of large numbers of acutely ill persons, rapid progression, and relatively high proportion of cases from upper respiratory symptoms and bronchitis to life-threatening pneumonitis and systemic infection affecting, among others, young previously healthy adults and children should quickly alert medical professionals. At the same time, public health authorities would be alerted to a critical and unexpected public health event and bioterrorism as a possible cause.
There are different tests done to diagnose tularemia. One is bacterial culturing. Although F. tularensis has been cultured from sputum, pleural fluid, wounds, blood, lymph nodes, and biopsy samples and gastric washings, the yield is extremely low and culturing poses a danger to the laboratory personnel. Another diagnostic test done for tularemia is blood testing. It measures the body's immune response to the infection, and a agglutination titer greater than 1 to 160 is considered positive and treatment may be started. A second titer demonstrating fourfold increase after 2 weeks confirms the diagnosis. A third diagnostic test is a polymerase chain reaction, or just plainly PCR. Tests a sample from an ulcer. The fourth diagnostic test is imaging, chest x-ray and ultrasound. A chest x-ray is done to evaluate the pneumonia, but only if the patient is considered to have tularemia. And the ultrasound examines the lymph nodes for suggestive findings of infection, but these findings lack specificity. Medical therapy in tularemia is directed at antibiotic eradication of the bacterium F. tularensis. Streptomycin is the drug of choice for this treatment, although less experience exists with other aminoglycosides. Gentamicin also appears to be effective. In addition, although tetracyclines are acceptable alternatives, increasing research supports the use of fluoroquinolones in the treatment of tularemia. There is no vaccine currently available, even though a vaccine based on a live strain of the bacterium was previously available, but it is no longer produced because of concerns about unknown attenuation, safety, and production of it.
To avoid acquiring this disease, we should avoid tick-infested areas, wear trousers and long-sleeved shirts to avoid tick bites, use tick repellents, frequently inspect the body and clothing for evidence of ticks, avoid exposure to dead or wild animals and wear gloves if such exposure is necessary. Hands should be frequently washed afterwards.
For our viewers out there, let us all be aware and cautious of the diseases so that we may all be prepared for the future. Thank you for listening. This is Amsley Sulit with ABS-CBN News.